Hi, I'm Christine Trevino. I'm going to be doing my newborn assessment. Go ahead and wash my hands real quick. Mom is still pushing, so we're waiting for that sweet baby to get here, which she's right around the corner. Mom's having a girl. Her name is going to be Charlotte. Mom already told me. While I'm waiting for her, we'll go ahead and clean the stethoscope as well. This is my pediatric stethoscope, pretend. And this is my diaphragm. Okay, because childbirth can get a little messy, I'm just gonna go ahead and put a pair of gloves on. Okay. Oh, I hear Mom. Little Charlotte's coming right now. And baby's crying. Hi, little Charlotte. Let's go. Oh, you're cold, I know. You just came from that birth canal. Let's get you all dried up. Make sure that you don't get too cold. Get you completely dry. Oh, she's crying. She's pink. She sounds a little wet. So we'll just keep that in mind. That's completely normal for little Charlotte. I'm going to go ahead and zero out this scale real quick. We'll go ahead and grab a weight on her. Okay, little baby. I have an assistant over here just for safety reasons because I don't have a the little sides that go up. All right, so baby is 0.9 kilograms. So for Mom, she is 1.98 pounds. She's a teeny tiny little baby. Okay, let's see how long she is. We'll just go from here and we'll go in centimeters first. Right there. Looks like she is 34 centimeters. And so Mom and Dad know about 13 and a half. Since you're right here, baby girl, I know you're cold, but we got these warmers on you right here. All these lights to help keep you warm. We're gonna measure your head. Actually, let's bring you over. That way everybody can, oops. Let's get you a nice clean towel though. That one's the dirty one. That one's wet. We don't wanna put baby back on that one. It should be way too cold. All right, come here, sweet pea. All right, and let's keep you covered a little bit. That way you don't get cold while we're doing these other things. Okay. So we already got your length. Now I'm gonna go ahead and measure your head circumference, and that's gonna be right above your eyebrows here. Looks like she's at 32 and a half. I'm gonna unbundle you for a second, sweet pea. Let's go ahead and get your chest circumference. We're gonna go right at the nipple line. Okay, looks like 32. And then the abdomen is going to be about 34 and a half. Okay, all right, let's keep you bundled up. Okay, so now let's go ahead and see what this heart rate's gonna be. It should be between 110 and 160. And I'm gonna listen for the apical pulse for 1 minute with my pediatric. And then just so anyone else in the room knows, I'm just gonna kind of tap my finger. So baby girl has a strong heart. She's at 150 beats a minute. Go ahead and listen to those lungs while we're right here. All right. Lungs sound good. No, no crackles, no wheezes. A little bit of the fine rhonchi, just because she's a little wet. Valve sounds. Valve sounds are hyperactive. I think baby's gonna be ready to eat real soon. All right, sweetheart, let's go ahead and get you to the back and listen to your lungs here. Okay. Now look at her spine. She's got that nice C shape on her spine. I'm looking at her buttocks and her anus. Looks like everything is there. Okay, let's flip you back over. All right. Now let's get your temperature and your respirations. All right, so I'm gonna take an axillary temperature for my baby. And then I'm gonna look for chest rise and fall. I'm gonna kind of feel for those breaths too. So baby should be breathing between 30 and 60 respirs a minute. I'm gonna count for 30 seconds and multiply by 2. All right, so baby's respirations are right at 30 and her temperature, her axillary temperature is 98.6, so everything checks out there. Her skin looks good. She looks, for her ethnicity, her hands are a little blue, so she's got a little bit of the acrocyanosis, but other than that, she's still crying, so we're still trying to work out all that oxygen to where it needs to go. She doesn't look like she's in any pain because she's not. It's not that pain cry, it's just a I'm out here in the world and I'm cold cry. All right, so let's check your skin for that sugar. Okay, everything looks good there. Her skin blanches as well. I don't see any jaundice on her. Her sclera either. We'll look in her gums in a second. Okay, she doesn't have, she has a little bit of the vernix on her in the creases. Not really any lingo. She's not a hairy baby. And I don't see any rashes, any stork bites, any Mongolian spots. She's just pink and pretty. Okay, now we're gonna check her reflexes. So the first thing that I'm gonna do, I'm gonna uncover her. She's gonna get mad at me because she's gonna get cold. And I'm gonna check that moral reflex. And baby went like that, spreading out her hand, so that one's there. I'm gonna get my handy dandy pen light out. I'm gonna look in her eyes. I'm gonna check for that blink. She blinks and her pupils are reactive, equal round and reactive to light. So all that looks good. She's pearl. And let's go ahead and check her. I didn't see any jaundice in her eyeballs either. I'm gonna check her rooting reflex. So I'm gonna go on her cheek. Oh, she does come this way. Okay, she's looking for that breast. Now I'm gonna go ahead and check that suckling. And I'm gonna feel her soft and hard palate while I do that. And everything's intact and she is definitely ready to eat. I'm gonna look under her tongue real quick, just since I'm in here, see if that frenulum is short or if she's gonna have any trouble feeding, and it doesn't look like she is. Her lips look good too. All right, check that palmar reflex. So I'm gonna put my fingers in her hands and she's gonna squeeze. Yep, it's there. Same thing for the toes. Okay, and then I'm gonna try that, the Babinski right here. So we're gonna take my finger down and her toes fan out like that. Let's try this one. Oh, goes like that, good. Now the tonic next, I'm gonna gently just help baby's head to one side. I should see the arm, the same side that the baby's looking. That arm should be extended and then the other arm should be flexed, and it is. She's, let's try the other way. And it is symmetrical on both sides. Okay. Now we're gonna see if baby can crawl. So first thing I'm gonna do actually is we'll check that that prone crawl. So I'm gonna put a little pressure on her legs. Yep, and she tries to, and then we'll try that trunk, see if she turns this way. Incurvation, there we go. The trunk incurvation, yep. And she kind of took her body like that. And then again, we already looked at her spine and her buttocks and all that looks good. All right, sweetie. Let's go ahead and turn you and get you covered. Okay, All right, so now I'm gonna start my physical assessment. I've done a little bit already, but I'm gonna check her head. It looks normal cephalic. I don't see any hematomas, the cephalohematomas or the kaput. Everything looks nice and good, so hopefully she won't have any problems with jaundice and trying to break down those red blood cells. Her skin looks good. Her eyes and her ears are symmetrical. Her eyes, we've already checked. They were nice and symmetrical. Her ears have that recoil on them, yep. So she is definitely to term. I see that she has the external ear canal. Looks like it goes all the way on both sides. So that's a good sign. Her neck looks supple. It doesn't look like there's any nuchal folds or anything in there. I'm gonna check her clavicle. Her clavicles are intact. It doesn't look like she has any kind of broken bones right there. Her chest is symmetrical. We checked that earlier when she was breathing, so all that looks real good. Her abdomen doesn't have any pulsations in it. We'll check those. Her belly button, her umbilical cord, excuse me, is obviously, we clamped it right after birth, so it's still wet. It's got that Wharton's jelly on it. Looks good. We're just gonna keep an eye on it, make sure it's healing appropriately. I don't see any hernias. I'm gonna check her femoral pulses. All that looks really good. She's got 10 fingers and she's got 10 beautiful toes. And I guess the next thing that we're gonna check on her is just to make sure that her hips are good. So I'm gonna go ahead and I'm gonna place my hands on her knees, and then also because she's so tiny, I can put them on her hips and I'm gonna push it in and then out, and I'm gonna listen and feel for a clicking sound. I'm gonna do it one more time just to make sure I didn't miss anything. Okay, so everything was good there. Since this is my little girl, we're gonna check her to make sure she has all her girl parts. So I see her mons pubis. I see she's got an opening. She has her vagina and an opening there. She's also got her clitoris. So all that looks good. If this was a boy, then I would check for the penis, make sure that the, oh my goodness, that the opening was on top and not like below or anything. I would also check to make sure the testes were descended, and then also I would check the rugae as well. And I would make sure, I mean, she was just born, but if I was doing it a little later, I would make sure that she's voiding appropriately. I would look for any meconium too. If she hasn't had a meconium, that black tarry, then I would definitely expect to see a couple of those before discharge. We've already talked about the jaundice. Oh, that looks, she looks perfectly healthy. I know mom is so excited to see her and cuddle her. So while I am checking my notes, okay, assistant, just make sure she doesn't fall. Just be right here, okay? I'm gonna move this over here. Let's go ahead and let mom hold her while I'm checking over my notes. There you go, mommy. Okay, there's your baby. All right, and just to make sure. Oh, the one thing that I didn't check, I would make sure that her fontanelles were not bulging or super sunken in either. So I would check her frontal and then her posterior. Her frontal is going to be a little more pronounced than her posterior. Her posterior closes, I believe, right away, and then the frontal takes a couple months to close, sometimes a little more, but I think on average it was 2 months, I think. All right, let's give you back to mommy. I would also check her breast buds and just to make sure that they were budding. It would be appropriate for age. Her umbilical cord, of course, had that clamp on it. The Ortolani's maneuver was for the hips. And I think that that's everything. would take my gloves off. And I would wash my hands. Thank you.